Today on Cultivating Care, we have Loren Funk, a former healthcare COO turned consultant. So, Loren, thanks for coming out to the farm to spend some time to share about how nature inspires care and care for the people that we work with and care that the people we provide our services with. And I wanted to have you come out to the farm to share your experiences in that. I know you've had a history of being in healthcare and human services, and it's where my passion is drawing me to, along with the garden, is helping people that are that need that constant care. You know, that it's not an acute situation of going to the hospital. They're a senior, you know, in later stages of life that need support. They might be a disabled adult that needs to have a different kind of living situation. And it's been great taking this journey, learning more. And so I'm using this setting as a way to get to know you better. We've had a journey already together for a while. Fun. And kind of see how we get inspired and how we learn more about care for others. So that's what this morning's about.
Okay, cool.
Loren, I'd like to get a little bit of a background of your healthcare and human services history. Also, we talked a little bit about COVID, and I'd like to learn a little bit more about how you see things post-COVID. What did you learn out of that experience that you think is better today, informed through the experience of COVID? So would you mind?
Oh, absolutely. So I was at Longstreet Clinic, which is a large multi-specialty physician group in Gainesville.
Okay.
I started there in 1993 and eventually became chief operating officer. And so served there for 30 years and saw the growth. We didn't start out at a very large. We started out about 23 physicians.
Oh, wow.
And then till now it's over 100 physicians, 100 mid-level providers, advanced practice providers. And I had responsibility for IT, for facilities, for all of the ancillaries, pharmacy, lab, radiology, and our electronic medical record, all kinds of things. So got a really big breadth of experience. I was very blessed in that because basically when we started something new, somebody had to do it, right? Somebody had to get it. So that was that. I didn't realize it at that time, but you know, it was helping me get to what we needed to do for COVID, even though felt totally overwhelmed at that time. It was not a good time at all. And between, you know, I would go from trying to find a supplier for N95 mask to then when we started doing the vaccines, you know, managing that process and that was a little more complicated than you might want to believe that it was. And to then having to have a conversation with what was termed non-essential staff, you know, because they were not doing surgery. So I had to let all the surgery staff, you know, go on, you know, they were basically laid off, furloughed. Yeah.
Okay.
And, you know, managing all of that while being scared, right? You know, I don't know what.
Yeah.
And, you know, I've got a family at home that I'm trying to take care of, but I've got all this stuff here. Just a side note, I say this a lot, and I got really upset with people who got to stay at home and would be online talking about, oh, well, I worked on this project or did this or did that. And I had some issues. I had some anger issues with that, to be honest, because we were there, and we still have patients to take care of. And that's fine. I didn't mind working at all. But so actually, COVID does then fit into another part of the story that led to what I'm doing now. So the year 2020, I was under a lot of stress, started having, I just wasn't feeling right and didn't know why. And, you can ask anybody in healthcare, we're the worst patients. We think, oh no, there's nothing going on. So kept on just not feeling right. We ride mountain bikes and was, having trouble with that. I never had trouble, is it what I'm eating or what is it? So get into the fall, my son and I are working on a trail. We cut down a tree, got into some poison ivy. I'm pretty sensitive to that. And I know usually what to do, which is I take steroids. But I took too much and made me had some issues that forced me to go to the doctor, which was good. Because then we got into the whole conversation, well, you've been feeling bad too, and what is all this about? So all that led to me getting, seeing a cardiologist, having a stress test, having a very high risk outcome on that. 2 days later being and getting a stent. So that was a lot happening in that time between COVID and that, and the realization that I had to do something about my stress. So that is what led to me. I don't like to say retiring because I didn't. I'm just changed my careers. But I did leave a job that I loved. I loved every part of it. Just got to the place that I couldn't do every part of it, all of it, and at the degree that, it needed to be done. So, so I left Longstreet in 3 years ago, and since then been doing consulting and fractional work.
Wherever that brings you. But
Yeah.
It's brought you to different industries too, right?
Right. Yeah, I'm actually not working in with any healthcare in that capacity. I do serve on an advisory board for a healthcare practice that I love. So that gives me the, that scratches that itch a little bit.
So as you were going through the garden looking at things, what came to mind to you in terms of this informs me about life? These are plants out here. There's a bunch of dirt out here. There's trees and birds. What comes to mind when you see nature and how you live life maybe a little differently when you see something in nature?
Yeah, I spent some time out in nature yesterday actually because I just so needed it. I had a very challenging, distressing email that that I met first thing yesterday morning.
Okay.
And so, really that was my first thought. I needed to get away and go. So I went to a park, of which there's so many. Love that about our area, but and ran and prayed and just was quiet, and
Centered.
so that's what it does for me. But as far as how it informs me is, I think maybe it's a lesson on space, a lesson on calm and peace, and stability. You know, that's, you know, we talked about how like the structure, the not only the plants themselves, but you know what you build to help them to be to help them to thrive.
Yeah.
You know, I think that's as much a part of this
Yeah.
as everything too. You know, it's what we're
Kind of thinking ahead of what supported needs over time.
Yeah.
That's designed into, this is here for it.
Yeah.
It needs it.
Right.
Yeah. 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 You've probably seen some of the things I'm sharing on Sowing Success, which is trying to take what I'm seeing out here in nature, and probably what is very inspiring to me is how things are designed to work and work naturally. And that's what has got me into compost and thinking about, this is not dead dirt on the ground, but it's living soil.
Right.
And how do I nurture that in a way that it can take care of itself, because I'm a supporter,
Right.
giving it conditions for it to.
Yeah.
And, you know, I think that's what we do with people too, right? Is we're trying to get the healthy soil for them to grow.
Yeah.
To be nurtured, to be, you know, given things that speak to them, that motivate them, that make them wake up every morning saying, I'm glad
Yeah.
I'm here, and there's something purposeful to do, and with people that, you know, care around me.
Yeah.
So as you have been in healthcare, what have you seen as the biggest challenges that you faced that you feel that's important for others to understand, that people that are not inside the industry of healthcare kind of take for granted and don't realize that, you know, these things happen behind the scenes that need to be taken care of?
Yeah. I thought you might ask a question sort of like that. And, you know, I was thinking about the events that informed a lot of what I feel now about healthcare, and maybe I didn't really understand why I did it when I did it, you know, when I started, because I started pretty young. It was my, really just my second job out of college. And even though I'd done internships and had an interest in it for several years, but thinking about my parents and their experience through healthcare, being in the hospital, going to doctor's visits with them, and since I was in healthcare, I was the guy.
Right.
I took care of all those things for my parents. And what struck me, and I'm in the business.
Yeah.
And I had trouble.
Right.
You know, I had all of these questions that no one seemed to be able to answer, roadblocks, and just utter frustration.
Yeah.
And if I was experiencing that, how much more so people who did not have the background or knew who to call or anything like that. So that really shaped the way that I wanted to help design. I didn't do it, of course, by myself, but help design how we delivered care and how we took care of our patients. Now, mostly either an acute session or just overall healthcare, primary care, and everything. We didn't really experience long-term care. I did with my parents, but not from specifically who I worked with. But it still had an impact, because there was, you've got the patients. I was always very sensitive to our older patients, because I knew that they had a son or a daughter that was taking care of things for them. So there was, it just kept the the circle just kept on growing as of the people that we needed to help. It wasn't just that one patient and everything.
Right.
So that had a big impact.
Kind of an ecosystem around it.
Yeah.
That is,
Yeah.
is patient, but what surrounds the patient is
Right.
is maybe as important
Yeah.
to provide care.
Right.
Yeah. Yeah. It's that anxiety. I mean, when there's a healthcare issue and there's, a change in someone's life that you're experiencing it for the first time.
Yeah.
I'm seeing it with my parents too, where they're in their mid 80s and they're, trying to figure out what's next. They don't really want to talk about what's next. They want to kind of live today,
Yes.
and be around what's familiar. I think the whole helping people that are around that patient, giving information and guidance and keeping them informed along the way.
Yeah.
Knowing that it's their first experience. I think as caregivers, challenge could be, I've seen this over and over again, it's second nature to me. And so maybe it's hard to have the patience and to be able to stop and explain something that might be obvious, but it's not obvious at someone that's new.
So in my position, I was responsible for the systems and procedures and everything that went around providing care, helping the providers to do that well. And so that helped me give me a much different perspective on walking through, what is a patient experiencing? What is a patient's family member experiencing when they, go to the website and need to make an appointment and trying to negotiate their bill, whatever it is, what is that perspective? So that was really important for me, because it's easy to get jaded, because I would think the other shaping experience would be COVID.
Yeah.
That was just totally new. And I still tried to find the really good thing or silver lining that came out of that, because that was very hard on healthcare. So that's where I really got more of a deeper appreciation for our people, the people, what they were going through. And so you're taking care of the patients, taking care of the families, and then you're taking care of the people that are taking care of the patients, that are doing the direct. And they
almost that's important.
Yeah,
to be
absolutely.
sustainable.
Yeah, absolutely. So that was a deepening experience.
How did you know that you were getting better at that over time as you paid attention to it and you focused in on it? Was it just continuing to strive and move towards getting better and getting a gut feel for that, or were there things along the way that you said, well, I actually saw this change as we focused on better, let's say, communication and awareness to the people around the patient?
I don't know. I wish I had done a better job of kind of measuring it.
Right.
Sound like a real business term, but that's such a difficult thing to measure. Maybe it's easier to look at it from a long time back to say that, it was gradual, but a change in sensitivity to knowing how I would react to something previously to now. It was not a straight line. Of course, and it was certainly not immediate. But even now, being out of it directly for 3 years, I'm still thinking about things that had changed, and my attitudes, it's changed even more.
Yeah.
Even being on the outside a little bit more.
Yeah, I find it's probably very difficult to measure kind of that human feeling, except for maybe surveys that say, how do you feel on this scale? And, in terms of how
Yeah.
we treated you.
Yeah.
We all love taking surveys, right?
Yeah. Well, I would, I don't know that the number of these interactions necessarily increased. Maybe I was just aware of them more. But I think another thing that the COVID experience in healthcare, changed so many. It was such a monumental shift, and I know for everybody, but really in healthcare.
Yeah.
And I think we got a lot more prone to have deep conversations and serious and honest conversations with each other about not only how we're working together, but how we're taking care of people and everything. So
We're going to get that, Matt. Yeah, so...
I thought Will was going to take care of it.
Will can't.
Yeah. So, yeah, that's interesting. That it's a human experience that you're working with. It's not a mechanical manufacturing. We've got this device that measures real time this value along the way. That you, in a sense, it's the spirit of it. Do you have the right spirit? Is it sensed? And having conversations to say, do we feel it's real now? This is what we're trying to do. We're trying to act in this way or create this kind of experience for our patients and our patients' families. Are we improving? Do we have more to do?
Yeah.
What's missing?
Yeah, I think another indicator would be the recognition of, we need the structure, but be careful about who we're serving. Are we serving the process? Are we serving the structure? Are we serving the system? Or are we serving making sure the system serves us and the patient?
That's right. Yeah. We try to look at it as reduce the admin kind of burden, and that in the ideal world, you're not even thinking about technology. Technology takes care of the things that are routine and can be done without a human. So we can do more of the human things.
Yeah.
And that, of course, AI is a big topic in that respect. But
I had a discussion with somebody this week about. So I was supposed to have going to have a procedure in a few months, and one of the choices is to have it done by robotics. Oh. And the surgeon that I was talking to is an expert in it. I was like, I'm just really uncomfortable with a robot doing my surgery. And he said, it's not a robot doing the surgery. I'm doing the surgery. And, the robot's just helping me. I said, but it could turn on you. You got to be careful about that.
Yeah.
But just thinking about the impact of AI and everything, that's I don't even know enough to. I know what I asked Claude to do right now, and that's about it.
So
maybe
what
it'll be
else
more.
in walking around the farm that you noticed that tells us about life? Is there any other observations that?
Well, maybe I'll just ask you. Yeah. Why gardening? Why? I mean, when did it start?
Turn this back on me?
Yes, exactly.
Okay, all right.
Yeah. When did it start?
For me, when did gardening start? It started after I had cancer, actually. It's when I just started life as a married adult. My wife, we moved to a new city, had my first job out of college. She was pregnant. within that first year, and I found out I had cancer, as we were expecting a child to come. And coming out of that experience, definitely a pretty scary experience in life, and wanted to have some agency on what am I doing to, do my part in staying healthy going forward. And the cancer wasn't from smoking, wasn't from something unhealthy. It was a blood cancer, but it put focus around growing organic food, eating well.
Yeah.
And that drew me into just being in awe about nature, starting with seeds and seeing what that turns into. And so that was a major force into getting into gardening. And then this evolved into, hey, I want to do this in my retirement. I want to go to the farmer's market and hang out there and sell vegetables.
And wear good hats.
Yeah. And it's evolved into being something that builds community for me. That's something that I didn't get into it at first for. It was more for the health. And lately it's become more as a place to invite people in and have these conversations, and to have my neighbors stop by. An intentional way to get us all together. We're spread out, everybody's on several acres around here, and surprisingly enough, I've introduced probably 24 neighbors to each other that live, within houses away from each other. They didn't know each other, so it's been great to connect people that way.
What's the connecting point? Your garden?
Yeah. Then picking up. I have a very small window on Monday evenings that they come to pick up their vegetables. And so I use that as a way to introduce people.
Yeah.
And we just sit at the picnic table up there and just hang out for half hour to an hour.
Was that intentional?
Or no, it wasn't. It just started
out?
Happening. And it was very interesting over COVID, because I was selling from the farmer's market, and then COVID hit, and that was in March. I had everything in the ground planted, ready to go, and the farmer's market closed. So over the weekend, I built square sites and posted something on Facebook and Nextdoor, and I got about 250 subscribers to that newsletter.
Wow.
And sold all the vegetables that first weekend. And then I just, at first it was a way for them to get out of the house.
Yeah.
And really early on, people were concerned about their food. So they were coming to get food that they kind of knew where it came from.
Yeah.
And then it started to be a connector to neighbors. They said, Roxanne, have you met, Bill? He lives, 3 houses down. And they didn't know each other, so introduce. And
wow.
And so we were down at the farm gate, and then I said, well, let's move it up here so people can be closer to where things are grown, and to have a picnic table to sit down and talk. Yeah.
That's cool.
Yeah. So that's, a lot of that being drawn into gardening. What I've found is it is a place to get recentered, to kind of let the stresses of life kind of melt away. This has like a dome around it. There's, for some reason, problems can't come in here, and every time I'm here, I'm just curious. I'm just walking around, tending to the next thing, and I just get a kick out of things growing. So yeah, it was having cancer and then wanting to eat healthy food was the original premise, and now it's sharing it with others.
Yeah.
Food that they enjoy to eat that's actually wholesome, good for them, and it's a way to take care of them, give them healthy food.
Yeah. How does the online store work?
I have a newsletter that goes out Saturday afternoons. I pick Saturday morning. I end up putting in the inventory, and then I send out a newsletter talking about what's going on and what's available, and they put in their order by Monday at 1, and then they come out at 6 o'clock and hand out vegetables. Yeah.
Wow.
Yeah. Yeah. So some neighbors that really never. I mean, it feels good. They say we're so glad you're our neighbor because they can get a healthy salad like every week. And
Right.
tomatoes and yeah, they get a kick out of having a little tiny farm in their neighborhood.
Have you ever thought about animals? Any animals?
No, I've thought about them. I'm not interested in going down that path at this point. I've thought about honeybees, but and maybe chickens for eggs.
Yeah.
We have a next door neighbor that does that, so I get my eggs from them. But
Right.
yeah, that's what I would do. Probably if
Do
I
y'all,
did
do y'all
more.
barter?
Yes, we do. We do.
So how how many leaves of lettuce is an egg worth?
Oh, it's usually a bag of lettuce for a dozen eggs.
Okay.
Yeah.
Okay. That's a
Yeah,
pretty
they're
good
about the same.
trade.
Yeah, yeah.
Yeah. Both of them, keep on keep on producing and everything. So yeah,
It's a good deal. It's
that
a good
is.
deal. Yeah.
That's a good economy right there.
Uh-huh. Yeah. I saw a show on Neighboring where a guy that just taking his whole farm and just walking to people further and further away, just saying, "Would you like some food?"
Yeah.
It's interesting. But yeah, that's this, for me, it inspires me to say, support. And some of the things that you were talking about earlier is nature knows how to do this, but how can I sometimes say conspire with nature?
Oh yeah, absolutely.
How can I, let it do what it wants to do and try not to get in the way.
Yeah.
But we do like structure. We like straight rows. Nature's not necessarily like that, but it makes it easier to pick when it's not randomly planted around.
Well, that's our job, right? Is to provide the care and the structure for to kind of tame it.
Yeah.
I mean, how long would it take for this just to be totally out of control and overgrown?
It's amazing, Lauren. I mean, it doesn't take much. I mean, it's on the edge of that all the time. It
Right.
really is. I mean,
Yeah.
you go and look at the perimeters. I mean, there's, that fence line is a pain because it's hard to weed in that area.
Yeah.
And I don't use any herbicides or pesticides, and so everything grows around here. And
Right.
there's a variety of stuff
Yeah.
growing. So I'm constantly either weed whacking or hand picking a lot of these things in the rows. I had to learn how to be proactive there.
Yeah.
I've got cultivating devices that allow me to just rake it down the whole row, and takes 5 seconds versus if I let those things grow and like 3 weeks later, it'll take me 1 hour, to get all that out. So it's, I'm making space for the things that I want to thrive.
Yeah.
So yeah, that's a little bit unnatural, but it
don't
gives
know.
me a sense of feeling I'm in control, or there's some order to what's going on.
Yeah.
And I think there is some beauty to order, to see, a
Oh.
line of lettuce.
Absolutely.
Yeah, and having all the same color together. I mean, I just,
Yeah, I would. My father would be extremely pleased with that. He was I wouldn't call him a master gardener, but he was pretty daggum close.
yeah,
And loved working. I mean, that's what kept him alive, I think,
Yeah,
for a long
yeah,
time.
yeah,
Just
yeah.
staying out there, even though he had a horrible back, and he would still be out there. It wouldn't matter even.
Sounds like me.
Yeah, yeah. So we'll see in 20, 25 years if we're still out here. But he loved the linear, and he was very particular about his rows, and young boy going out there trying to help him most often didn't do it like he liked it. So he would be very very pleased with that.
The whole having things in order, it does carry over into life too.
Oh, absolutely.
Into life, into work, when things are structured, it
Yeah.
makes things a little bit easier,
Yeah.
a little bit more predictable.
I think the new term is like reducing friction, maybe.
Okay. Yeah, I like that.
Yeah. Making things a little smoother. Why wouldn't I do things to set myself up to do things more easily? But I tend to think that, oh, well, it needs to be hard. I've got to work for it.
Yeah, or you try to do things a new way when there's a way that already works. You just
Right.
need to do it that way each
Right.
time.
Right.
Almost creativity can create some chaos.
Yeah, definitely.
Well, I appreciate you taking time to hang out with
man.
me in the garden, and
I'm
be a
honored
little
that you asked
curious.
me.
Yeah. We've known each other for a while, and there's kind of a chemistry with people that you feel like there's a kindred soul there that kind of values some of the similar things, and has kind of just a healthy look on life, and I feel that you've got that, and so I appreciate you spending some time with me today.
Well, I'm excited about the direction that you're taking, and that's I think that's a worthy group, for lack of a better term, but to serve in that way,
Right.
serve the servants.
Yeah, we need purpose in life, and so I'm at a stage that I want my work to work towards things that are for the greater good of people. So I think it's a challenging space. We're doing a lot of work to try to understand it. These conversations are a part of that, but we feel like we need to understand, the ethos and what people are trying to accomplish, and we're coming from this technology perspective that is kind of anti what these people are about. They're not about technology, so we're trying to say, how can we make that technology kind of fade to the background,
Right.
And so if we can put good structure, we can design good systems, integrate things to make things easy. We want them to have more time for care.
Yeah. That's important work. Appreciate it.
Thank you, sir.
All right. Cool.
Thanks for coming out. I want to give a special thanks to Loren for spending time with me on the farm. His honest view on caring for others by caring for people around the patient was insightful to me. And a special thanks to you for watching. If you're a human services leader here in Georgia and would like to join me for a conversation on the farm, please reach out to us using the link in the description below.